Once you've made the big decision about closing, moving, or merging your practice and have a general idea about the next steps for you, for your practice and your employees, and your patient and business records, you need to plan the continued administrative, technical, and physical safeguards of that patient's health records. Now, patients and clients have a unique trust with their healthcare provider that you will continue to provide them continuing healthcare and continuing access to their health information. Now, you are also expected to securely keep the information secure and follow your professional college standards and health information privacy legislation. In this episode, I'm going to help you with providing clarity about records management in your group or shared practice or solo provider. Guide you to develop health records management plan when you close, move, or expand your practice, and contribute to the health information privacy compliance in your practice. Welcome to Practice Management Nuggets Podcast. Practical practice management and privacy tips to help you start, grow, and improve your healthcare practice. If you are a clinic manager, team lead, healthcare provider, or practice owner, these practical tips will save you time and money. My name is Jean Eaton, your practice management mentor and your practical privacy coach with Information Managers. I help you manage the pink elephant in the room. Now, just a reminder, I'm not a lawyer and I don't play one on TV or on a podcast. These are my recommendations based on my experience and research and not legal advice. Let's get started. Closing, moving, and merging your healthcare practice. Whether you are at the end of your career or you are moving or leaving your current practice, you have a number of responsibilities when it comes to protecting the data you've collected from your patients. In the absence of a healthcare provider's regulatory college requirements, these standards are reasonable best practices that other healthcare providers can adopt for their records management policies. Now, many professional colleges have a standards of practice for records management to ensure patients' information remains safe and secure, and yet accessible to both the patient and their new healthcare providers. Now, some colleges don't have additional requirements when you are moving or closing your practice, and some do. So you will want to make sure to go back to your professional college and see if they have some specific requirements for your practice when you close or move your practice. Generally speaking, today we're going to talk about the requirements under the Alberta Health Information Privacy legislation. So if you're in a different province, the requirement specifics may be a little bit different, but generally we're talking the same type of information. Now, we know that patient health records are used for the continuing care and treatment of our patients. Now, while I was the director of health records in community hospitals, I had the dubious pleasure to receive a parting gift from a community physician who had recently retired. He did not have a transition plan in place and simply brought his patient records from his office to the local hospital to manage. Now, I know that other hospitals had similar experiences, and even the provincial archives inherited physician records. And that's one of the reasons why we now have these privacy legislation requirements and professional college requirements so that we don't have orphaned patient records. It is part of the responsibility of the healthcare provider to ensure that patient records are maintained securely for the entire retention period, even if that healthcare provider has moved on to practices or moved to other locations. Now, the healthcare colleges, professional colleges, may have some additional guidelines about what type of records can be left with custodians. Under the Health Information Act, a custodian is very specifically defined as a member of a health service provider who is designated in the regulations as a custodian and is defined under the Health Professions Act. So this very specifically identifies custodians as being physicians, pharmacists, chiropractors, dentists, dental mechanics, registered nurses, and the Alberta Health Services and other health regulatory bodies in Alberta. So if you are not a member of a designated health profession that has been named under the Health Information Act, you are not a custodian under the Health Information Act. So this is really important when you are moving or closing or merging your health records. You need to be very clear about who is the custodian as defined by legislation. Oftentimes, the word custodian is used to identify the person who has the hands-on day-by-day care of the patient records. So let me be clear about what a custodian is not under the Health Information Act. A custodian is not the clinic manager. The custodian is not the clinic owner if the clinic owner is not also a custodian defined by the Act. So if you have Mr. John Smith, who is the business owner, he's the one that's provided the financing and the funding and looks after all of the financial pieces of the clinic, but that Mr. John Smith is not a physician or a chiropractor or a pharmacist or otherwise a health provider as defined by the Health Information Act, then the business owner is not a custodian of the records. The business owner may have to sign documents and may have the authority to pay the employees and pay the vendors, but they are not a custodian under the Health Information Act. So if you are a custodian, a healthcare provider, and you are closing your practice, maybe you're retiring, the business owner cannot be the custodian of the records. Okay. Now, if you are a physician or a pharmacist or a chiropractor or a dentist, and you are also the business owner, then you continue to be the custodian of the records. Now, you can transfer those records to another custodian, and we'll get into a little bit more detail about those steps. But we need to make sure that the patient records continue to be available for the continuing care and treatment of those patients. So let's get into some details about what that may look like. Patient records can be maintained in a variety of different formats. They might be in our traditional paper format. They might be in electronic or digital format, an electronic medical record, have been scanned into PDF record files, a variety of different situations. So you need to be very clear about what is considered patient records. Now, the custodians, the care providers, are responsible for the secure storage and disposition of individual patient records, which means that it needs to be maintained for the entire records retention period. So there are a number of steps that every practice must look at when they are moving, closing, or merging records to another practice. So the first step is patient records. You need to know what you've got to know what you're responsible for. You need to make sure that you have continued access to those records and you provide the appropriate notification to both the patients and to other folks. Now, if you are going to transfer those patient records to somebody else, another custodian, there are some additional steps that we need to talk about regarding information sharing agreements or information management agreements. What you need to consider as far as EMR migration and making sure that you have an inventory of those patient records. So let's take a look at what we need to inform our patients about the changes. So in the notice to patients, an individual has the right to access any record about the individual that's in the custody or control of a custodian. So this means that the information in a healthcare record belongs to and must be provided to the patient when it is requested. So when you are moving healthcare clinics or a healthcare provider is moving from one location to another, you must inform the patient that that physician, that healthcare provider is moving and give them the opportunity to follow that healthcare provider to another location or let the patient stay at that same location and see another healthcare provider. And the patient also has the right to access the records and make sure that they can have their own personal copy. So you will anticipate that you're going to have a number of each of those types of requests for information. So make sure that you've got appropriate policies and procedures in writing and that they're up to date and that your staff know how to manage those policies and procedures. They know what to do. This is a great time to make sure that you've got an efficient as possible process. You know that you're going to receive a lot of requests for information to transfer it, so make sure that you take the time now to make sure that you've got an efficient process. Now, in the practice management success tips, I've given you some sample template policies and procedures to help you with that. So you can also make it easier for patients to make their requests. There are perhaps forms and instructions that patients can download from your website, print off, and complete at home to bring to the clinic when they come for their next appointment. That's going to make that process a little bit easier and faster for your clinic staff to be able to complete. So that way you don't have to have the patient fill out a bunch of forms when they're at the clinic. They can bring them to the clinic. So you can anticipate that you're going to have a lot of records requests. So make sure that you've made it as efficient as possible for the patient and also for the staff to be able to process those records. Now, you might even consider hiring additional short-term staff or contractors to help you with this step about processing patient requests or access to the transfer of records. Now, you can contract a service provider to help you with this, and make sure that you have an information manager agreement with that service provider and be very clear about what that information manager can or cannot do on your behalf when they receive those information requests for access to information. Be also very clear about what your fee for those access requests will be. So if there is a provision under the Health Information Act that there is a basic fee of $25 per request, and that's for access requests. If you are transferring a summary of information from one provider to another in Alberta, you cannot charge that fee for a transfer of information request. So if you have a records request for transfer of care and you're just providing a summary of that patient record, perhaps there is a report that you can print out of the EMR that is a patient summary, or you've used SOAP in your SOAP notation in your paper records, and you've got a chart summary that you can provide by paper, you cannot charge for that sharing of information for transferring care to another healthcare provider. If it is more than that basic summary report, yes, you can charge, but do you want to? And that's a decision that you'll need to make within your organization. Some organizations find that it's more time intensive to charge the patient for that fee to transfer the record than to actually collect that fee. So you need to make a decision and apply it in a way that's transparent so that patients and your staff easily understand what your fee schedule is going to be for managing those patient records. Okay, so let's take a look about patient accessing their own health record. So a common request for patient records include accessing their own information for their personal use and requesting that the records be transferred to another healthcare provider for continuing care and treatment. So if the patient requests to receive a copy of their own health record, the patient usually completes a consent to release form, and the office retrieves, reviews, and processes the records. Sometimes there is a charge for the time and effort required to prepare that patient's information, or the healthcare provider may choose to waive that fee. So make sure that you review and update your policies and procedures so that you've got a very clear process that is transparent and easily understood by both your employees and how you're going to share that information with your patients. Make sure that you provide a notification to patients about what your process is, what fees are required, and what steps they need to do to be able to access it. Do they need to fill out a form or not? And transfer records you need to make a determination about whether or not you're going to do these on a one-by-one situation. So a patient will individually request the clinic to share their information with the healthcare provider when they move to a new location, or perhaps you're going to have an en masse transfer of records from the physician's healthcare practice in their first location, and now they're moving to another location, and they're going to transfer all of those records. So we're going to talk about the data migration process in just a moment. Now, there are some other people that you need to notify, and there are some timelines. So depending on which health profession that you're a member of, the timelines may change and the details may change about who you have to notify. But generally, you need 45 days notice to inform your patients that you're going to move your practice, that the healthcare provider is moving, or that you're going to close your practice. There are some very clear details about what you must include in that notification. So make sure that you check the details, because if you haven't properly notified the individuals, you may be asked to do it again. So you can send letters individually to patients. You can put a notice on your website. You can have a poster in your practice. There are a number of ways that you can choose to notify patients about your change in practice. Now, a physician must provide a minimum of 90 days notice to their patients in Alberta that their medical practice is going to close. So if there is no expectation of offering ongoing care. So if you are relocating and it's reasonable that your patients can continue to follow you, 45 days notice is sufficient. But if there is no family physician that's going to look after your practice and the patients don't have other choices, you must notify within 90 days. You can also use posters to let patients know that there are changes, and you can have the patients continue to ask additional questions from their receptionists or the healthcare providers. So in the practice management success tip, I've given you some templates about what those notification posters might look like and forms that patients might sign to request access to the records. But make sure that you review the details that are specific to your provincial legislation and your professional colleges. You may also need to notify others. So many professional colleges require their members to notify their college about their forwarding address information, when they plan on closing, who has access to those records, and you may need to notify other services like receiving e-labs or discontinuing your access to Netcare, informing other information sharing networks like your primary care networks. So make sure that you have properly engaged and notified all of the shareholders about your change in your practice.
You are listening to Practice Management Nuggets podcasts. Tips to help you start, grow, and improve your healthcare practice and your career. I help you manage the pink elephant in the room. Get the show notes from our website at practicemanagementnuggets.live.
Now, ideally, when a practice is changing, we want to have a good and seamless transition. Now, ideally, the best time to have an information manager agreement that identifies how you're going to terminate or close your relationship with your healthcare providers in your practice is when you first get started. The second best time is right now. So, and the worst time to negotiate how you're going to terminate your agreements with your partners is when you are anxious to leave. So when there is some type of a conflict. So be very clear about how you plan to close or move your practice or do relocation when you first get started with your practice. Now, oftentimes I get called in to help to resolve some conflicts. And here are some steps that I would share with you. Review your existing documents. So it may have been some time since you reviewed your policies and procedures or reviewed your privacy impact assessment that you completed 10 years ago. Go back and review those documents. Ideally, those documents will have the termination clauses in there that you agreed to 10 years ago and you don't remember now. So go back to those original documents and see what they say regarding termination clauses. In the absence of any additional documentation, the documents that you created, those termination clauses that you created at the beginning of your practice, is what's going to guide you now about managing conflict and planning the transfer of patient records at this point in time. Now, if you had a previous document that you mutually agreed upon in your privacy impact assessment or your information manager agreement, and you want to change those terms now, as long as it's mutually agreeable, you can do that. If it's not mutually agreeable, then you're going to have to go through some type of a mediation process. So you can contact your professional colleges to help you with that mediation process. You can get a professional mediator to help you with that. But make sure that you have the agreements in writing so that you have met all of your regulatory requirements under the Health Information Act and your professional college, and is mutually beneficial for all of the parties involved. This takes time, so don't underestimate the amount of time and effort that this is going to take. And that's why I encourage everybody to make sure that they have accessed the information management agreement, information sharing agreement, and your successor custodian documentation. And if you haven't already looked at it, do download the practice management success tip called the top 3 agreements your healthcare practice must have and why. And this is where I walk you through those key pieces of those documents to help you to be able to move, close, or merge your practices in some future time. So to be able to properly manage the records that you have, you need to know what records you have. So make sure that you take the time to inventory the patient records. If you're closing your practice, you need to be very clear about what records you have in place so that you can make sure that you've accommodated and prepared for the entire records retention period. If you're selling your practice, you want to know exactly what records that you have so that the new healthcare provider who is going to purchase your records know what records that are there, so they know what they're responsible for. So I want to share with you just a couple of tips about your patient records and transferring them. So if you are a new healthcare provider that has moved from one location to another and you have patient records that you want to bring to that new practice, make sure that you have that discussion with the new practice partners. So if you are receiving a new healthcare provider, you don't necessarily have to accept all of those previous patient records. You could, that might be an advantage to you, but when you do that, you need to make sure that you understand how those records were created and maintained, because now you're assuming that responsibility of records that you are accommodating into your practice. Similarly, if you are the healthcare provider moving into a practice, don't assume that they are going to automatically assimilate your patient records into their system. So if you had paper records and you are now moving into a practice that has electronic medical records, don't assume that they're going to scan all of those records into the EMR system. So be very clear that you've got a discussion on both sides about any previous patient records. Now, of course, if you're leaving a practice, you can't abandon those records. So you need to have that termination option about identifying how those patient records are going to be managed when you leave that practice. So all of these things are identified in that information manager agreement, and make sure that you have that discussion, because there are a lot of things that can go wrong and this will cost you time and money. Now, when you are inventorying those patient records, if you're going to do a retention archive process, that inventory is going to help you with that. So before you archive records, you may want to take a look about the retention period and to see if there are any records that have met that retention period and can be securely destroyed. So you don't want to save more records than you need to, and you need to make sure that you've made that retention period. So generally, it's 10 years from the last visit or the last entry, and 10 years from the date the patient becomes 18. So if the patient is now 28 years of age, then they probably have met that 10-year retention period. Now, do check with your professional colleges about that retention period, because it does change from the type of record and the type of profession that you're in. It changes from province to province as well. But generally, it's 10 years plus the age of majority. So make sure that you've identified what records can be destroyed, and then you need to record the destruction. So in the practice management success tip, I've given you an outline for a procedure template about archiving and destroying records. So that will help you to be able to document which records that you have included in your patient inventory, and which records can be securely destroyed and which are going to be archived. So it may seem easier to keep records forever rather than destroying them at the retention period. But remember, the longer you keep those records, the longer you are responsible for them. So if you've got an offsite storage bin that has records from 20 years ago, and there is a flood or a fire in that offsite storage bin, you need to have that patient inventory about what records were there. You want the inventory someplace else than where the records are, because then you have to notify those patients that those records have been destroyed. If they hadn't met that retention period, and you had an act of God, we had a flood, and all of those records are no longer available, you may have to notify all of those patients. So make sure that you have met all of those requirements about retention, archiving, and destruction. Okay, now the other thing that we see frequently is when there's an electronic transfer or data migration that happens when a patient's records have been moved or a system has been closed. So a physician may be moving from clinic A to clinic B, and they had EMR A and EMR B. So now they want to move all of those patient records from EMR A into EMR B. And you can do that, but it can get really tricky. So just because it's in an electronic database doesn't mean that it moves seamlessly from one area to another. So you're going to have to discuss how that data migration is going to happen. You're going to be very clear about the documentation about what data gets transferred, because not all data is created equal, and not all data gets transferred. So typically, the demographic information goes from one system to the other pretty cleanly. The billing information, the prescription information, the attached documents tend to not transfer from one system to another. So you're going to have to ask very specifically about whether or not that's going to transfer. And you're going to have to test it. You're going to have to do some quality assurance to make sure that everything transfers from one system to the other as you anticipated. Now, whenever you do a data migration in Alberta under the privacy legislation in Alberta, it triggers a privacy impact assessment. So that privacy impact assessment is a comprehensive review about your data migration plan and how you're going to check to ensure that it includes everything in that electronic transfer of information or that data migration. And the reason why the PIA is required before you do that is we know that when you transfer information from one system to another system, largely, not everything gets transferred, and there's information that gets lost, even in the best scenarios. So the privacy impact assessment is going to ask those questions about how are you going to test to make sure you know what got transferred, how are you going to identify what didn't get transferred, how are you going to make sure that the information that didn't get transferred has been maintained in some other fashion so that you don't lose patient information. So if you're doing that data migration, remember that you have to allow appropriate time for moving from one system to another. And of course, there's some costs associated to that. So in your information manager agreement, you need to address who's going to be responsible for those costs, how are those costs going to be managed, and who's going to do the work, and do you have the appropriate information manager agreements with that vendor to do the work. So this is something that we can talk about more if you have additional questions about data migration. It is not a slam dunk easy thing to do. So that's my big message to you, is it is doable most of the time, but it is not an easy thing to do. So make sure that you've allowed yourself enough time and enough money to do this right. Because if you don't do it right, it is a privacy breach. And then you've got all other types of offenses that can apply if you've lost information. So make sure that you download the Practice Management Success Tip about closing or moving your practice. We have 2 versions available for your healthcare practice and for a chiropractic practice. They are specific to Alberta. However, they are common steps that are going to be applicable for every province. And if you're not a member of the Designated Health Professions Act in Alberta, perhaps you are a physiotherapist or a mental health counselor. The Health Information Act legislation does not directly apply to you. However, that is the highest standard available, so that if you follow all of these steps about closing or moving your practice, it is going to meet the requirements of the other legislation under PIPA, usually in Alberta, that is required. So make sure that you download the Practice Management Success Tips for additional information and assistance. So you get the procedure templates, and you get the templates for the forms for notification for patients and for patients to request access to records.
I'm excited about this new season, and I'd so appreciate your help to spread the word with your colleagues. First, make sure that you subscribe and add a review on whatever podcast platform that you use. Next, take a screenshot of this episode that you're listening to right now and share it on your Facebook, Twitter, LinkedIn, or your preferred social media channel. Remember to tag me and I will reshare your post. When you share the show, it makes it easier for people just like you and who like what you like to find the show. Until next time, this is Jean Eaton, your practice management mentor and your practical privacy coach.